A hearty good afternoon and welcome to the session of Complementary Feeding in Infants. We are glad to have Dr. Alok Kumar Gupta among us today to help us understand the topic. He will take us through that and more in this session today. Doctor, you have the stage.
Good afternoon, everyone. My name is Dr. Alok Gupta. I am concerned neonatologist and pediatrician in Apollo Cadal, Greater Noida. Today's topic is complementary feeding. It is also known as weaning in infants. This the complementary feeding usually start at 6 months of the age till 2 years. This period is very specific because breastfeeding of the baby mother is not enough for the growth of the baby. So why complementary feeding is started at the 6 month? Why not 4 month? Why not 8 month? It is because there is one reflex known as the tongue thrust, which is usually prevalent in the infant less than 6 months of the age. When we try to give the solid food to the infant less than 6 months of the age, they will generally spit out due to this tongue thrust. At the age of 6 months, this tongue thrust reflex disappears and baby is able to receive the solid food properly. That is why we start complementary feed at 6 months of the age. Also, the breast milk of the mother is not enough for the continued growth of the baby because during first year of the age, baby's weight and height and head circumference, all the growth parameters are continuously increasing. So, baby needs outside food apart from breast milk. So, first question is what to give, how to give, when to give. Okay. First, one concept is minimal dietary diversity. That means there are 8 food groups. First, vegetables, fruits, cereals, also known as grain, dairy products, and protein. Protein is divided into 3 parts: animal protein, plant protein, as well as egg protein. These are 8 food groups. Usually, babies should receive at least 4 food groups out of 8 in a day. In recently conducted National Family Health Survey 4, it is established that 20% of children, only 20% of children of India are receiving this 4 food groups out of 8. That's why prevalence of malnutrition is very much high in our Indian setup as well as the whole global community setup. Then what is the minimum food frequency? If it depends on whether baby is breastfeeding or top feeding. If baby is breastfeeding, the minimum food frequency during first 6 to 8 months of age is at least two. After 8 months, from 9 months to 11 months, it should be at least three. From 11 months to 12, 24 months, it should be at least three. After 8 months, baby should be offered 1 or 2 snacks along with the uh, major meals. If baby is top feed, the minimum feeding frequency should be at least 4, irrespective of the age group. Then, what is the amount to be fed to the baby? It also depends upon the age of the baby. If baby is between 6 months to 8 months, baby approximately required 2 to 3 teaspoon of the food. From 8 months to 9 months to 11 months, if we take 250 ml bowl, baby require at least half bowl. From 11 months to 24 months, baby require at least 3/4 bowl of the 250 ml wall volume will be 250 ml. 3/4 of 250 ml baby will require from 11 months to 24 months of the age. After food, you can give boiled cool water as well. Quantity of water is not limited, but you can give the baby as much water baby wants. Then, whether should give ghee to the baby? Yes, you can give ghee to the baby. You can start from 1 or 2 drops per day. Then continuously increase the amount to 1 or 2 TSF per day. Then next question arises, parents ask whether we can add salt and sugar to the food of the baby during first year. No, we should not add salt and sugar during first year of life because added salt which we give in the feed are excreted by the kidney and baby's kidney are not mature enough to handle that added salt. So during first year, no sugar and salt should be added. Then whether when can we start egg to the baby? Yes, we can give egg to the baby in the first year of life, but from 7 months of age onwards, first we should give egg yolk, which is non-allergenic, and from 9 months or preferably after 1 year of age, we should give the egg white protein because it's allergic. The next question, I guess, whether can we give non-veg like chicken, fish to the baby during first year of life? We should not give any non-veg food item during the first year of life because baby's digestive system is not mature enough to handle this non-veg food item. So we should start the non-veg food item from first year onward itself. Then, what food should be avoided during the first year of life? People usually ask. We should avoid at least two important foods which should be avoided during first year of life. Is one is honey, second it is the nuts. Honey usually give people give usually honey water in case of mild cough and cold to the baby during the first year of life. It is very wrong practice because one bacteria known as botulinum, which grows in the honey itself. Most of the time, when honey is not fresh, there is risk of contamination to the honey with this bacteria, and baby can become paralytic soon enough after consuming this baby, consuming this honey. So we should not give honey during first year of life. And nuts, there is chance of choking, particularly during ingestion of peanuts. So we should not give peanuts or any type of nuts during first year of life. And the next question is, I guess, when to give to introduce solid food to the preterm baby, like 28-week baby. When should we give food? So start complementary food. It is based upon the chronological age of the baby. It is usually established by various studies that the between chronological age of 5 months to 8 months, we can start the complementary feed to the baby. But it's basically the individual decision. We have to assess the baby for their development milestone, whether there is tongue thirst is present or not, whether baby's other milestones of babies are within normal limit or not. Depending upon that, your pediatrician can prescribe when to start complementary feeding to this baby. Then, what food can be given and how much? If during 6 months of the life, we usually tell start with the apple puree, banana puree, papaya puree to the baby. It should be fully mashed initially so that baby can easily swallow it. Gradually, you can increase food, the number of food one by one. Main concept is you should not give one or two new food in a week. You should not give every day new food. Otherwise, baby will digestion will get disturbed and baby will start diarrhea. Second is you can give pulses to the baby like moong dal khichdi. You can give different pulses one by one. There is no recommendation to restrict any type of pulses. Then when the baby become 9 months of the age, there is a reflex on pincer grafts appears. There is a concept of finger foods. Baby can pick up the fruit, the food like a pencil with the help of their index finger as well as the thumb. So you can give the carrots just like a potato. You can give uh, Anuj, Anuj. Hmm? Okay, okay. Now I want to request any question is there. I will be happy to answer. Is there any question? Okay, thank you.